Menendez.
Mr. Witty, your company's slow progress in restoring services and advancing loans to providers caused operational disruptions with consequences for providers, pharmacies, and patients across the nation. For weeks, hospitals and providers had to deal with low loan offers and onerous terms from the company, in some cases less than 1% of their typical weekly billing, all while patients suffered. Your company is the nation's largest private health insurer and the largest physician employer in the country, earning billions in profits every quarter. It's unacceptable that it took so long to help providers during a crisis of your creating. Now I'm concerned about what's going to happen on the back end. So do you commit to not exploiting the destabilized provider markets that you created to further acquire other subsidiaries? That simple yes or no would be great.
Senator, absolutely, we will not take advantage of that, and we have not. I'd also like to reassure you, we understand that in the effort to go quickly in terms of setting up our loan program, we didn't get all of the terms and conditions right. We fixed that very early, and we've now been able to advance $6.5 billion.
So let's talk about that. UnitedHealth, as you have just said, claims to have distributed $6.5 billion in financial support to providers. But you're dealing with an enormous backlog of claims estimated to be easily over $14 billion, with some estimates putting the total impacted services at many multiples of that. In other words, your accelerated or advanced payments were a tiny fraction of the total amount of services affected. It's my understanding that UnitedHealth and its subsidiaries know to the penny what the average provider bills in an average day, week, or month is. Yet providers in my state and across the country were struggling to keep their doors open as they waited for these payments. What reasonable explanation could you have for taking so long to get these accelerated payments out the door?
Senator, thank you again for the question. Unfortunately, United does not know the flows to folks from other payers than United, which is part of the reason why our initial approach was not as effective as we'd have liked to have been. We put in place a mechanism which, for the vast majority of providers, gives them authorization on interest-free loans within hours of application, and that remains open and available for providers who need it today.
It seems to me almost incredible to believe that you do not know a company that is so long established and you don't know the flow of what a daily, weekly, monthly amount is to a certain provider. That's hard to believe.
So we understand the flow when we are the payer, but oftentimes we're not the payer, and those would be the situations. And as I'm sure you are aware, we have been making loans to underwrite the cash flow consequences for other payers, not just UnitedHealth.
Well, it seems to me that you wasted a lot of time trying to pull a fast one by imposing onerous loan terms on providers. Can you commit to not demanding loan repayments until the claims backlog is cleared?
So we've streamlined all of our terms and conditions, and yes, we've already told providers that there is no need to repay these interest-free loans until 45 days after they have concluded they are back to normal.
Do any of the loan terms prohibit health providers from working with any of United or Optum's competitors?
No.
Now, following the breach, you offered to do breach notifications for covered entities like hospitals and provider groups that are still grappling with severe and ongoing disruptions to daily operations. Now, this commitment is an important step in the right direction, as providers should not be bound by the burden of providing HIPAA-required breach notifications. But no prudent medical group can rely on vague promises containing no specifics with respect to timing or implementation. Providers currently face mounting concerns about their own regulatory exposure should United not fulfill these promises. Further, as more patients become aware of the possible disclosures of their sensitive information, they will turn to their providers for information and assurances, neither of which can currently be provided. So when can providers expect concrete details on breach notifications in writing from UnitedHealth Group?
Sir, this is our top priority. We want to get this done as fast as possible, and we're working with the regulators to ensure that we can get that communication as quickly as possible.
Okay, so can you give us a time frame? Is that a week? Is it a month?
I think it will be in the next several weeks.
And what sort of documentation will UnitedHealth Group require of covered entities, and will agreements include information about limitation or waiver of liability?
That's something we're working through with the regulators so that we can be very clear to those providers.
I'd like you to respond to the committee when you get
Of
to
course.
that conclusion. Thank you, Mr.
Thank you, Senator Menendez.